So welcome, Randy. I'm so glad you're here, and welcome, Dr. Laura.
Hi, Mabel. Hi, everybody. Thank you for having us.
Thank you for joining us. So I want to jump in real super quick and ask, so Randy, as his wife, is so wonderful. She's not on the screen, but she has come, she's been twisting his arm to tell him to come over and get the treatment because he has been suffering in pain for 30 years. Tell us, Randy, what in the world happened to you for you to suffer like this? Tell us.
Well, I picked up a back end of a small car, and it was icy out, and the young lady was scared to death, and she couldn't get out. She wasn't going to get out, and I thought, well, I'll stop our vehicle, and I got out, and the boys were with me, but they were very young, and Karen was with me. But I went over and I told her, do not get your wheels up onto the curb. Do not take off because I'll have a hold of your bumper. So I got it up there. She didn't pay attention. She took right off, and I went spinning around into the street. And I've been not feeling good since.
Wow. And that's, just a fluke accident that has caused you 30 years of just terrible pain. And so you were telling about all the drugs that you've been on to try to deal with the pain.
Yeah. You name it. I've been on them. I mean, I've been on pharmaceutical painkillers for quite a while.
Yeah. And it's just life altering. And for 30 years, I've had some issues where I've had pain and I've been like for 2 days and I'm like, I can't even think, I don't think I can make it another day. And I really can't even imagine 30 years. And I know so many of you guys who are out there, either you have pain or you have loved ones who have pain. And I'm so thankful for Randy's wife who is on the battalion, and she's on with us and praying with us and researching with us. And when she heard about this and how it helped my mom and just saved my mom's life, like if you haven't seen those videos, you've got to go to freedomforce.life/pain, and you will find out that my mom was on 3 opioids a day, and now she doesn't even take aspirin because of the treatment that she got from Laura at prescribinglife.com. So thankful, because it was bad. It was just, there's not even words to describe what you go through. So thank you, Karen, for doing that. So she told you, you're going to Houston and you're going to see Dr. Laura, basically, right?
That's right. Going to Houston, baby. Yeah.
What is it? What?
It's an old Eagles song, and during the song, he goes, "We're going to Houston, baby."
Oh.
Yeah,
okay, cool. I guess I don't know the song. I should, since I'm living in the Houston area. All right, so tell me what happened when you got to see Dr. Laura.
When I got to see Dr. Laura, she did talk to me for quite a while about my situation and what I've been doing. We did a telemed before that, and so she got some decent information from me at that point in time, and Karen. So when we sit in there, and what I was really after was a sciatic pain to just go away. I wanted it to go away because that is the one pain that I can't deal with, and I can deal with neuropathy, burning pains, and all these other pains, but that's the one that I could not deal with because it would just take it all out of me. And
it's down your leg, right? The sciatica is down the leg.
Yeah, you have no balance. You have no way to keep yourself up. You got to grab onto something to hold on to. People that have this pain, they know exactly what I'm talking about.
Right.
I got lots of doing the same thing.
That's what my mom had.
So anyway, she then started targeting that area, but she also worked on quite a bit of my spine because I have cervical problems as well. So she's been working on my cervical as well as my low back area. And
okay, hang on. You're going too fast. So then what you did, you went in, you talked with her. She goes over what the treatment is about, and she's going to describe it here in just a second. But basically, she gave you a treatment, and tell us what happened.
Well, she worked on the low back and the sciatic area, and I just wasn't thinking on it. I wasn't thinking it was really going to work right off. That's what I thought. To be real honest. And so she said, "Okay, you can get up now." And I got up, and she was smiling. She was smiling, and she didn't say anything. She was smiling. And then I got up, and then I turned around, And she goes, how do you feel? And I had to stop and go, I feel no pain. And after, sorry.
That's huge. It's huge. Every time you relive that beautiful moment, I know it just takes your breath away because you've gone through so much for so long. And I can understand this is a hugely emotional moment in your life to finally have this relief. I'm just so thankful. I'm so thankful. I know you have some other issues that she's helping to resolve, but this debilitating, life-altering pain is over. And it's just so exciting. This is what really the Millennial Kingdom is about. And we're sharing this, you guys, from just person to person, because we clearly won't get it from the government. We clearly won't get it from Big Pharma. We're just sharing it with each other. All these treatments that are really, truly help getting everyone the relief that they need. So exciting. So yeah, so she's been doing more treatment. So I want to quickly, because our time is going to be very short, but I'm so thankful. So thankful to hear your story. And so, Dr. Laura, would you do me a favor? Would you hold up that cool sign, that little picture that shows the step down? Because this was typical. See, you're not typical, Randy. Typically, everyone follows this. And that's, my mom was this, the orange one, where it's just step down slowly. It took like 23 treatments. But you are one of the very blessed ones who just went from terrible pain of a 10 to a 0. And it's just so exciting. So very few people have that. And so that's why I wanted to have you on. We have, every time I go into, you can show it. That's good. Thank you, Dr. Laura. But every time I go over to see her, I see people in the waiting room, and it's just so fun to see people. Everyone is just so thankful, so amazed, because they've tried everything that from Big Pharma, and nothing has worked except to make them into a zombie. So tell us, Laura, what do you do that makes this wonderful thing happen?
Well, first of all, I want to thank Randy for sharing your story. I think it's amazing. It was also I'm so proud and thankful to work with you. What we do is called neural therapy at Prescribing Life. And basically is the application of local anesthesia into specific areas of the nervous system with 3 main goals. The first one is to diminish inflammation. The second one is to increase the amount of blood flow, which is going to bring more oxygenation and nutrition. So we're improving the environment, allowing your body to heal faster. And the third one is to modulate the nervous system, sending a signal that says, pain doesn't necessarily need to stay with you for your whole life, and it can stop. And when we do it over several sessions, your body starts receiving that signal, and that's what it does. And in some cases, just with the first session, that happens as well. So it is a procedure that has been done for over 100 years. It is very new in United States and in other English-speaking countries, but there's studies that show how good it works. And I love it because it's extremely safe.
Right.
And
no side effects.
Yeah. No side effects.
It relaxes you.
Yeah, exactly. And it makes you, and you can feel the difference immediately. Randy was saying that I was smiling when he got up from the bed, from the table. And the reason why I did that is because when he got in the table, it was so difficult for him to get in because of pain. And when he got up, he was like a completely different person. And, when you've been for so long in pain, I think he didn't even realize what was going on. So it just made me smile to see him acting different already. And
that's so exciting. That's just so exciting. Yeah, he'd had lots of surgeries, so lots of scar tissue from the surgery. It's like makes more scar tissue that's making more of this inflammation and all of that. But the just small injections of lidocaine, just little, and just really, it just seems miraculous to me that it's something simple like that and can have such a wonderful effect. So I don't want to take up too much of everyone's time. I wanted you guys to see this wonderful story of how he's doing so much better. I wanted you to hear about it. It's just, I could have people on here literally all day long because it's just exciting to see all the people getting better. But I wanted you to see it. Go hold up the card, Laura, would you please?
The information.
Yes, prescribinglife.com. There's the number 713-352-8249. Just if you want to email contact@prescribinglife.com. And Randy said this, they do a telemed ahead of time. So, if this is really something that's going to, be good for your case. What were you saying, Nora?
No, basically that's it. I was about to say that in the telemed, we figure out if you're going to be a good fit for your case. So, for example, like Randy, he doesn't live in Houston or Texas, so you can know if we're going to be able to work in your case
before you come. Yeah, here, because not everybody lives in Houston. Lots of people all over the country need this. So come to Houston, and you might see Melly in the waiting room. You just